The agency's mission has always been about serving the entire family and entire communities. How do we have thriving, healthy families? And that's how this concept of the whole person or whole family care and well-being has evolved, of bringing different programs and services that wrap around supporting a family to thrive. The heart of this is really a mindset change. It's a culture change.
We are thrilled that we're finally starting the Child and Family Wellbeing Department, and it's really an opportunity for us to take a holistic approach to making sure that families have what they need to meet all of their children's social, emotional, developmental, and safety needs.
It's really bringing together a family of one under this new department and really connecting our workforce to understand what that continuum would look like and what role they play in making this big, broader vision of child and family well-being throughout our county.
It's seeing parents not as people that maybe not be able to take care of their child, but maybe seeing parents as partners that need some support of learning how to help their child. What do they need? How do we support that family?
Within the Child and Family Wellbeing Department, we're going to be broken down into 3 separate departments. One is going to be the Office of Child and Family Strengthening. Then we're going to have our Administration Department, and then we're going to have the Office of Child Safety. The Office of Child and Family Strengthening is really the department that's going to be able to move upstream and provide services to our families.
Hi, Melissa. How are you today?
So what does that mean? Does that mean, do we have to work with our behavioral health team if there's mental health in there? Do we need to work with housing? Do we need to work with our self-sufficiency team? Now we'll be able to pull all those partners and thread everything together to be able to make sure we have something for our family.
When I first started in the agency, there was an attitude of when a family's in crisis, when in doubt, take the child out. But I found that always odd, that why do we need to traumatize the family, the child, the extensive public costs of going through the court system when we don't have to?
The prevention, getting upstream, and getting families what they need so that we reduce the number of families who ever come into contact with the traditional child welfare system is really the big goal. I'm hoping that we really are able to assure families that it's okay for them to ask for help, that we're going to have the help that they need.
Let's put ourselves out of a job. You know, having that big goal that our children and our families and our communities don't need us anymore. They're doing well, they're self-sufficient, they're ready for school, they're ready to learn, and ultimately they're ready for lifelong success.
We've talked about, like in the medical field, can we teach people how to be healthy before they have to come to the emergency room? How do we provide the help and the support to a family so they don't have to come to the emergency room? How do we teach them? How do we engage with them? How do we provide them services and training and coaching? And so this new department that we're launching is going to give us that opportunity to do that.
I am trying to change that trajectory to be able to say, let us try this. And be very forthcoming with the families. If this doesn't happen, if you don't help us help you, then here are the consequences. But if we're in there together and you're working with your family network, oh, this is going to be beautiful. It's beautiful.
What I hope is that helping families always is the first thing we think about, and then we'll figure out the rest of those pieces later.
Really partnering with families. It's not this, I'm going to tell you what you need. It's that let's get on this journey together and figure that out together.
Start tackling equity and disproportionality within child welfare services. Make sure that we're providing support and services to our families and youth of color.
Everybody, our county will have the type of same services in every pockets of our community.
I can't imagine doing anything else other than supporting kids and families.
It's just a beautiful journey to be able to see how we get to serve others and make that positive impact.
I'm doing this work because I think I'm making a difference. I think I'm affecting the lives of children.
I'm the voice of a youth who can't speak. I'm the voice of a baby who is 10 months old and can't speak.
This is the department that is the catalyst, the accelerant, with the might of the entire agency, Health and Human Service Agency, making sure that all our families with children are healthy, safe, and thriving.